Okay, let's unpack this. We've got some pretty focused revision notes here. Basically a list, right? Pathogens linked to conditions with some key details.
Exactly. And this deep dive is all about zeroing in on the most important bits from this specific list. The aim is to help you pull out those key associations fast.
Yeah, whether you're actually revising or just want to understand, like, what causes all the coughing.
Precisely. So the mission is quick extraction, quick understanding of these connections.
Right, and it's a list format, which is great for, quick recall.
Yeah.
So let's just jump in. Pathogens and their sort of calling cards, starting with viruses.
Sounds good. First up on the list is respiratory syncytial virus, RSV. The big link here is bronchiolitis.
Bronchiolitis, that inflammation in the small airways, often in little kids.
Yeah, exactly. That's the key RSV association in these notes.
Okay. And what about that really distinctive barking cough? Croup.
Ah, yeah, croup. According to this list, that's the classic sign pointing towards parainfluenza virus.
Parainfluenza. Got it. And the super common one, the common cold.
Well, the main one listed here is rhinovirus.
Yeah.
That's tagged as the usual suspect for, that everyday cold misery.
Right, rhinovirus. Makes sense. And influenza virus, that seems pretty straightforward on the left.
It really is. Influenza virus causes, well, the flu. Simple as that. That's a definite high-yield link to nail down.
Okay, clear enough. Let's shift gears to bacteria then, especially those causing pneumonias. The notes highlight Streptococcus pneumonia first.
Yes, and the really crucial point here is it's listed as the most common cause of community-acquired pneumonia, CAP.
Number one for CAP. And CAP just means pneumonia you pick up out in the community, not in hospital, right?
Exactly that. And while strep pneumo is the most common, the notes also mention Haemophilus influenza as a cause of CAP, too.
Okay, so Haemophilus also for CAP, but wait, Haemophilus has a few things listed next to it, which is where it gets interesting.
Yeah, it does. It's also flagged here as the most common cause of bronchiectasis exacerbations.
So flare-ups when those airways are already damaged.
Right, and also linked to acute epiglottitis, that really serious swelling at the back of the throat. So multiple hits for Haemophilus.
Okay, multiple links. CAP, bronchiectasis, flare-ups, and epiglottitis. Definitely one to watch. Now, Staphylococcus aureus.
Pneumonia again. But the key detail, the context clue in these notes is that it often happens after someone's had the flu.
Ah, the post-influenza pneumonia. That makes sense. Like the flu weakens things and staph moves in. Okay. The notes also separate out atypical pneumonia, which bugs are listed there.
The list puts Mycoplasma pneumonia and Legionella pneumophila under that atypical heading.
Right, atypicals. Often tricky, maybe a dry cough for both. But the notes give us specifics to help tell them apart. For Mycoplasma.
For Mycoplasma, it mentions flu-like symptoms before the dry cough typically starts. And complications are flagged too, like hemolytic anemia.
Breakdown of red blood cells.
Yeah, and erythema multiforme, that specific skin rash. Those extra clues, especially the non-lung stuff, are really important details from this list.
Definitely good distinguishing features to lock in. And Legionella pneumophila?
The classic link here is spread via air conditioning systems. That's a huge context clue. Like Mycoplasma, often a dry cough.
Okay, aircon, dry cough. Anything else?
Yes, the notes point to specific lab findings, potentially lymphopenia, low lymphocytes, deranged liver tests, and hyponatremia, low sodium. Those labs are key differentiators listed for Legionella.
Aircon, dry cough, those specific lab results. Excellent markers from these notes. Okay, moving on. Pneumocystis jirovecii.
This one's highlighted specifically for causing pneumonia in HIV patients. And the characteristic feature noted is few chest signs on examination.
So you might not hear much with a stethoscope.
Exactly. But they get exertional dyspnea, breathless when they move. That mismatch is a classic pointer in that patient group, according to these notes.
That's a really valuable distinction for recall there. And finally, Mycobacterium tuberculosis.
Yeah, TB. Causes tuberculosis, of course. The notes mention it can present in many ways, but list the classic symptoms: cough, night sweats, and weight loss.
That classic trio, strong pointers towards TB based on this list.
What's interesting is how this concise list manages to pack in not just the bug disease link, but these really vital context clues or standout features.
Like the post-flu staph, or the aircon for Legionella, or the HIV link for pneumocystis.
Exactly. It's quite efficient.
So yeah, wrapping this up, what this deep dive really shows is that there's a whole range of different bugs causing these common respiratory problems, and getting these specific links down, this bug causes that condition or has this specific feature that's the high yield stuff this list is designed for. Perfect for quick revision.
Absolutely. Knowing these connections and the distinguishing details that are listed is pretty crucial for that rapid recall.
Hmm.
And thinking a bit broader, based on the notes, you see how Mycoplasma and Legionella can both cause similar symptoms, like the dry cough.
Mm.
The fact the notes then add those extra details, like the labs for Legionella or the preceding flu-like illness for Mycoplasma, it really highlights how vital those specific clues or the patient context are for telling things apart, even if it wasn't explicitly spelled out for every entry.
Right. It implies the importance of those finer points.
Definitely. And this list is really curated for that kind of quick learning, giving you the core facts and key differentiators.
Exactly. So if you're looking for more structured revision materials like this, you can check out resources like passthemsra.com and freemsra.com.
Yeah, good places to look for more revision tools.